Okay, so we'll pick up, guys, and I want to start with where we left. Maybe I should take back to the one slide before this. So we basically have talked about how I have tried to make a case for you guys that when it comes to advanced dementias, and in the absence of us being able to ascertain the persistence of emotions in any definitive way, it's a lot safer to work with emotions. And that being said, then we move on to the next slide. What are the 5 primary emotions? Because ultimately we keep talking about all these things, but honestly, if I go out there and ask any number of people training to say, give me the 5 primary emotions, the chances are I might get 3 or 4, but I'm not going to get 5. And which is interesting, and even in the profession that we're in, if you don't know what the primary emotions are and you're trying to diagnose illnesses, becomes a little worrisome. So these are the 5 primary emotions that all of us as human beings, you, I, everybody experience on an everyday basis. The emotions of joy or happiness, discontentment, fear, anger, sadness, or melancholy. So the important thing here is when we go back to the understanding of the normal brain and the normal behavior, the normal brain functioning, and we talked about the emotional regulatory circuits. We talked about how the limbic circuits are so intertwined with the self-monitoring and regulatory circuits. And so basically what is happening is the generation of emotions and the regulation of emotions are all happening in real time. And what is important for people to know is that the generation and the regulation of emotions in dementia is impaired, and the more advanced the dementia is, the more impaired it is. So what happens and we're going to just, so it's regardless of the emotion. What's going to happen is if there's a trigger, no matter how little a trigger is, the response in dementia, depending upon the stage of the dementia, because the more advanced the dementia, the less the regulatory mechanisms, and therefore higher the response in amplitude. Secondly, when you show an emotional response, it stays on for much longer. And thirdly, ordinarily emotions will extinguish after a period of time. They are very slow to peter out because, again, the regulation which reins back the emotions is not there. So in essence, what ends up happening is no matter what emotion it is, you will invariably see an out of proportion response. So whether it is the emotion of fear, whether it's discontentment, whether it is anger, whether it is sadness, and even joy or pleasure, which we know are not as often expressed because we know they are diminished, regardless for that given situation, they will always create out of proportion responses. And so what is important for everybody here to understand is that emotional or the behavioral categories which are being the result of the impairment emotional circuits are all out of proportion. And of course, which is not a surprise, because many of us who've been doing this long enough were taught very early on that people with dementia have catastrophic responses. And those catastrophic responses was tied in with their emotional responses. And depending upon the severity, the amount of catastrophic the propensity you see is congruently related to that. So let's talk about the vocal expression. So that was the broad framework for all all behaviors in this category and all and what happens to all the primary emotions. So let's talk about vocal expressions. And for some people, this would be equivalent to noise making. So this is what we need to understand, that vocal expressions are specifically representing the two primary emotions of anger and joy in individuals with advanced neurocognitive disorders. Now, in all our experiences with these individuals, please reflect upon your involvement and tell me how many times you saw these people to be happy and how many times did you see them to be angry. And I think the answer is fairly obvious, that most of them are always showing anger way more than happiness. In fact, the ones who show happiness, we want to keep them forever because they become our joy. And the ones who show anger, we want to discharge them as quickly as possible because it becomes unbearable. So the vocal expressions, and again, I'm talking about noise making. So I'm giving you a twist here, guys, that all noise making you hear is based in primary emotions of either anger or joy. And I can bet you 99.999 is because of anger. So these are some of the examples. And so I'm gonna, and so this is what's important, is to understand this continuum of emotion of anger. And it goes back to the question that was asked in terms of trying to separate the little worrying from intense, specific type worrying to a context to a clinical disorder of anxiety disorder where worrying, it becomes an illness, because not all worrying is illness. And similarly, when we talk about noise making, then basically what you see here is a continuum on the spectrum of expression of severity of the primary emotion of anger. So the commonest one that we see are the brief explosive outbursts. I mean, we see this all the time, and something happens and all of a sudden you hear this explosion. It just happens and it goes away. And so basically that is at the early end of the continuum of this emotion of anger. The second is becoming argumentative or quarrelsome. Now remember, when you have a brief explosive outburst, you just let out steam. You've blown steam and you seem okay. But when we get into the stage of argumentativeness, then remember, we're not just blowing steam. We are now actively engaging people to argue with. Even when they're walking away, we will continue to chase after them and argue with them and become increasingly quarrelsome. That's a very old British expression. I love it. And it's really about becoming quarrelsome, because that is what we become oftentimes, is quarrelsome with each other. And that represents the next accentuation of the expression of anger, which is still all under that umbrella of vocal expressions, which in your daily utilization probably will fall under noise making because that is what happens. They are making noise because noise making is not just nonverbal or non-language based noise making, it can be language based noise making as well. And the third is what I call as a dysphoric syndrome. So now what is happening is anger is escalating further, where you are now seeing a change, where the emotional symptoms are now quote unquote swinging. So it is still predominantly irritability and anger, but don't be surprised if it gets thrown in a lot of loud crying and whatever, because now what is happening is the anger is reaching to a level where it's losing its specificity, and now it's encompassing other primary emotions. And so the emotional symptoms in a dysphoric syndrome are mostly swinging amongst anger, irritability, discontentment, and often manifestations of melancholy. But at the same time, this is what you will also see, that these people, in addition to demonstrating what they are demonstrating, are also verbalizing, if they are able to, certain cognitive schema. My apologies, it should be cognitive symptoms, it should be cognitive schema or cognitive distortions. And those are projecting, blame, or distrusting. So this is when you'll have people who are really out of sorts and are blaming or becoming suspicious, and at the same time are also showing some behavioral symptoms of being very intense, loud, they are quote unquote agitated. Here, the word agitation is used as a symptom of motor restlessness, pacing, walking up and down, and being very distracted in their attention. So you have a person who has this episode, which is called a dysphoric syndrome, and basically it has various components to it because now it is a dysphoric syndrome. Remember, a syndrome is different from a dysphoric symptom. You can see a dysphoric symptom and not a syndrome. And if you see a dysphoric symptom, then you will only see the emotional symptoms and you don't see all the others. But on the other hand, if you see further intensification of the expression of this particular emotion, then it becomes a syndrome. And as it further escalates, it becomes destructive syndromes. And I am sure you guys have seen plentiful of these expressions where you see them shredding briefs, towels, pillows, and picking away self-abusive behaviors. So one is destruction directed outwards, and the other is directed onto oneself. But this again, in that continuum, is a step higher than dysphoric syndromes. So in many ways, you start with those brief, explosive outbursts of anger. The next on the spectrum is you become argumentative or quarrelsome. If it escalates further, you can have a dysphoric symptom or a syndrome. And if it escalates further, you can have destructive syndromes. And these are all, and again, this could be destructive syndromes in the form of taking utensils and banging them hard on the table, basically going berserk with that sort of thing, which we capture as noise making. But again, the understanding is to try and put some constructs which are measurable, definable, because noise making to me isn't. And so destructive syndrome um, is the ultimate, not the ultimate, the penultimate component. And the ultimate component of this is the primal scream. And I'm sure you guys are very familiar with these noisemakers. These are blood-curdling, repetitive noise making that ends up happening. Now, what I need for people to know is that people don't necessarily have to go through demonstrating each of these steps. They could easily bypass in between and not even show the very first step and only show primal scream. Likewise, all you see when it happens are destructive syndromes. I have simply broken it down for you on a continuum of understanding the severity of its manifestation. But it can skip any of those steps and go straight to that particular, because there are people who don't show all of this and only end up, I mean, how many times I go and read through the night, well, the guy shredded his brief over and over again, took the pillow and all the feathers are out, and it happens every night. Or they'll take a towel and rip it to shreds, or they'll take their shirt and do the same. And so I don't see them having any argumentativeness. I don't see them having any dysphoric syndromes or symptoms. I just see destructive, or I see so basically, I was just going to say.
I gotta go home. I gotta go home. I gotta go home. I gotta go home. Hey, 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 hey. I gotta go home. I gotta go home. I gotta go home. I gotta go home. Hey, 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 hey.
So that was just an example. I mean, this is what it is, and you can hear them say, I want to go home, or you could just hear them, hey, 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 or whatever else. And so basically, again, it's trying to help people understand the continuum of that anger, which can run through that gamut, or it can skip stages and just present itself in a one form, and that is the form it stays in for that particular individual. So now the other emotion to be expressed under this is that of joy. Now, we've already talked about the fact that these are not very common, and when we see them, we want to just hold on to them, because frankly, they become our entertainment in many ways, because we just have a ball of a time as we are so overwhelmed with all the stuff that goes on around us. If one person is expressing joy-based behaviors, I tell you, my staff will prohibit me from discharging them anywhere, and we'll keep on to them. We'll hang on to them because that's our stress reliever. Now, not happens very often, but it does. So here again, there is a continuum of being effusive to elated to euphoric, and sorry.
A question whether to total in the mind to suffer the things and hours of very disfortunate to consequence to see if troubles of might posing in them to die to sleep returns to dream or die.
So that's just an example of them talking loud and fast. Now, mind you, you can talk loud and fast even when you are exhibiting anger. So it's not specific to joy, but this was meant to capture both, talking fast and this is more like that manic type behavior. You don't often see it, but when you see it, you want to hang on to them because they do give you lots of pleasure. Anyway, so again, when you hear people screaming and yelling for things to be done, it's a part of that noise making, because what takes your attention is the noise. And this is just trying to put some framework to noise making. And similarly, when we talk about, or we have individuals, rattling bed rails, tabletops, calling out for staff and stuff. And the reason why I have broken down this noise making or vocal expressions into these different constructs is because when I get called in to assess noise making or vocal behaviors, in my evaluation, there are 6 subtypes of those expressions. 6 subtypes of vocal expressions or noise-making expressions. Now, all of us who have dealt with the noise-making clearly recognize they are the hardest ones to manage. And even with the best of our efforts, we are pale in our abilities. And one of the reasons for that is because it is the largest heterogeneous group of behavioral expressions. There are 6 subtypes, and all of them require their own identification and their own care planning. And obviously, we're not going to have time to talk just about that because that itself is a 2-hour conversation or a presentation. But here's the important thing, regardless of what it is when you hear noise making, when you have vocal expressions, then basically it is important for us to recognize the unintended, out of proportion manifestation of emotional responses. So in some ways, these people aren't really as angry as you may think they are. It is just that their responses are majorly out of proportion to what the trigger may have been, and the trigger may have been absolutely inconsequential, and you may never even know what the trigger is, and even then you end up seeing such out of proportion responses. And so what is the meaning of the behavior? The meaning of the behavior or the expression is, particularly when it's based in anger, is one of 2 things. Either the person, particularly when you have the brief reactive or brief explosive outbursts, is basically them saying to you, please appreciate I am in a defensive mode, which means I am kind of giving you the warning. It's like a shot across the bow. From people who know in medieval English times, a shot across the bow was a warning to the enemy ship. You move any further, we'll attack. So those expressions are a shot across the bow to say, I'm warning you. This is what is happening. Or it could be, I am now in an aggressive mode. Please appreciate that, particularly when we start to look at the quarrelsome, dysphoric, destructive continuum. And so you have to be accordingly looking at it a bit differently. And again, like I said, there are so many of them. And the meaning of the expression with joy, as much as we want them, really what they're saying is, please help me control my emotions, because I can't control my emotions. I may not be as happy, and I might get into trouble if I continue to be escalated. So in some ways, as much as we partake in their joyous disposition, in many ways we're sort of doing contrary to what we should be doing in behavioral care planning. But it's just, like I said, the work is so hard and it's so difficult that one of those people is worth their weight 10 times in gold, because it's such a stress breaker. And so we sometimes do contrary, not understanding, obviously, not purposely or whatever, but the fact is, they are, when they are expressing this, really asking you, please contain my emotions rather than make them. Okay, so then moving on to the next category, which are the emotional expressions. And this is very important. The first category was meant to capture the 2 primary emotions of anger and joy. The emotional expressions are meant to capture the two primary emotions of melancholy and discontentment. So I'm just going to break it down because the behavioral scale, obviously, when you start doing things and 5 years later, you know so much more than where you were, but the scale's been validated, so you can't really change its face validity. But that's important to know is, appearing sad or tearful is a melancholy emotion. Irritability is a discontented emotion. Expressing themes of fear, if they are able to, morbidity or somatic complaints, these are all based in emotions and cognitions of melancholy. And of course, this here, when you're mimicking and mocking and being dismissive, are emotions and cognitions of discontentment. Similarly, being sarcastic, teasing, calling people bad names, whatever, are based in emotions and cognitions of discontentment. And of course, this here is based on feelings of melancholy. So, why is it important to separate these two emotions and understand them on their own merits? So, here is the basic essence of evolution of a human being over millions of years of evolution, that we as human beings are innately averse to pain, whether it's emotional pain or it is physical pain. We will go to any extent to make sure neither of those afflicts us in as much as we can help. And basically, protection from pain becomes our primary defense mechanism. This is who we are as human beings. You look at and reflect upon your day, entire day long, and you will find whatever you're doing, you're basically using defense mechanisms to protect yourself from pain. Whether you want to be on time and not be yelled at by your boss, or you're not home in time to make meals for the kids and they're all disgruntled and causing you aggravation. Always look on anything you do. Everything you do is to protect yourself from pain. And what's interesting is it does not change regardless of the stage of the disease. If anything, we've already established that the experience of melancholy and discontentment is actually heightened. So the propensity to painful experiences are that much more in advanced neurocognitive disorders. So there are two ways in which we deal with pain. If we get thrown into having to experience it, one is to cope with it, and the second is avoidance of pain. And this is what we talked about: prevention of pain and then coping with pain. And these two become the holy grails of every human being in everything they do every single day in the course of their day. So what is coping with pain? Obviously, coping with pain is applicable to when you are experiencing emotions of melancholy. And basically what it is how we cope with pain is we perform a catharsis of that painful experience, which is crying and crying and weeping. So, in essence, when we are experiencing melancholy, then what we do is we are performing catharsis of that experience. And this is akin to what, grandmother used to say, go have a little cry, it'll make you feel better, because that is exactly what the purpose of crying is to allow a measured decompression. So you're feeling the pain of melancholy or sadness. And Stacy, am I running out of time?
So this is the 1:30 mark. I have to laugh because every time my face pops up, I'm like a bearer of bad news.
No, that's
Um,
okay.
so it's we're at 1:30 and the next piece is the actual application
Okay.
um
Can I
related
finish
to the
this?
case examples.
Can I just finish this and the rest? They're gonna have to call me back. I'm sorry.
Okay, no problem. Okay.
Sorry, guys. I knew I wasn't gonna finish it. It's a 10-hour workshop. So anyway, so it's catharsis of pain, which is it's a measured decompression. So basically what it is from an observer's perspective, from you looking outside in, it looks like the person is suffering. But no, guys, this is just the opposite. From an individual's perspective, it's relief from suffering. So experience of melancholy as an emotion is where you bring in coping, and you cope by catharsis, which is weeping and crying, because it allows for a measured decompression. And from the person over there says, oh my God, look how poor soul, he's crying, whatever. No, from my perspective, think from my perspective. I'm trying to decompress and I'm trying to relieve myself from suffering. Now, the other way of is avoidance of pain, which is discontentment. So, a simple way of understanding is as follows. If I don't want to expose myself to pain, then what do? I start out by being mean to you. As soon as I am mean to you, what I'm hedging on and betting on is that I'm going to piss you off and you're going to shut down and show me the finger and walk away. So in essence, what I have now done is I have proactively clamped down all active communication between you and I. And once that happens, I've created a barrier or a distance between you and I, and thereby I will not be exposing myself to hurt. So you see how that discontentment expression is also to manage pain, but as a way of avoiding pain because you were just being a jerk. And everybody leaves you alone, but that is exactly you wanted, because you don't want anybody to talk to you, because you know when they start talking to you, you will likely be hurt by someone or something someone said, because that is your makeup and that is your style. So this is how those two emotions are, and therefore preventing pain. So this is important. The purpose of the expression of melancholy is you to recognize if somebody is being weepy, that they are really trying to do a measured decompression. I know it's a bit of an oxymoron because they don't regulate their emotions in the way. So it may not be measured, it may be just all out decompression, explosion. But the fact is that is what is happening. And it is about the coping with pain. That is the purpose of this expression. And what is the meaning of this expression is please help me in my catharsis. So don't tell them, don't cry, it's not a good thing. What if your wife finds out? All that stuff. No, help them, allow them, create an environment for them, a safe place for them to be able to have this catharsis, because this is a way to decompress, which is a way to relieve pain. Now, what is the purpose of the expression of discontentment? It is attempts to create barriers. So we need to understand if someone is making faces at somebody else sitting across the table, and they've taken a shining to this person to make faces, for whatever reasons, they're basically telling this person to be so far away from me because I don't want you to engage with me because I don't want any pain. And the meaning of the expression is really saying, please don't take me for a jerk. I'm not being a jerk. I'm not being an a-hole. I am simply trying to protect myself from pain. And that is why I'm being mean. That's why I'm calling you a fat bitch. That's why I'm doing this and this and this, because I'm simply saying you're not going to talk to me, and therefore I'm going to be protective of myself. So the meaning of this expression here is, please don't take me for a jerk. I am simply trying to protect myself from pain. So moving on to the fretful expressions, which is the final category in the behaviors coming from the emotional regulatory systems. So basically, this is where it comes in, the primary emotion of fear. And we have covered all the other emotions, and the fretful category is the category which is representative of the primary emotions of fear. So here's something I need to take you back to developmental psychology and attachment theories. You guys may remember the Bowlby and Ainsworth attachment theories, and I'm going to give you a very brief overview, because what I need for you to understand is psychologists have actually proven these theories to be holding and true even in patients or residents with advanced dementias. So this is what happens. It is the crux to that, of course, is mom and child, but obviously the world has changed. Now you could be two dads and a child, but the issue is a parent figure and a child, and the bonding which occurs between the two of them. And as I said, these attachments are valid throughout our lifestyle. So what started out as the attachment between mom and child, now we know is true and valid in marriage, in family, in work, and also remains valid in all the stages of dementia. And that is important to know, because this is what happens. We know there are different types of attachments that people make between mom and child, and there are the secure attachments, and of course there are the anxious attachments, and there are the avoidant attachments, and then there are the disorganized attachments. And we're not going to go into the specifics of that, because that itself is a long lecture. But the reality is that, if a mother is sitting in a room and is doing her paperwork, crocheting, cutting her vegetables, food prepping for dinner, an 18-month-old child, if they have a secure attachment to their mother, they will leave her side, they will roam away into the other room, come back through the door, do a peekaboo, and come back, and will have no difficulties, because they don't have to have their mother in front of them by their side to feel safe. On the other hand, if you have an anxious attachment, then when we say the babies are making strange, the reason they make strange is because their attachments with their parents are anxious, avoidant, or disorganized types, because to them, they don't feel safe unless they are stuck at the hip. And that attachment, the basis of that attachment, forms the basis of your life's journey and goes on till dementia. And so this is important, and we've touched upon this a few times, is that if those attachments, whatever they are, ultimately they all get stored in your brain as mental images. Remember, we talked about that at the very early stages of having the inner world order of those mental images. And therefore, it creates that hard drive, the database of all the attachments. How many times, I mean, my primary training being psychiatry, how many times do I deal with people that say, well, you know what, my girlfriend is just can't, like, she just is riding on me all the time. She can't let me go. I mean, she's so possessive and all that stuff. The bottom line is her attachments are very insecure or disorganized, or the boyfriend's attachments are the same. And of course, this is what happens is your old attachments get played out into your new experiences, and then depending upon what it is, you end up showing that kind of response. So the important thing here is those attachments are lifetime manifestations and will demonstrate themselves in every which way. So this is what happens in advanced dementias. We all recognize that people who have advanced dementias are they have no recognition of the world around them. They have a complete loss of recognition. Now, you know and I know that how we feel safe, the first thing it begins with is familiarity of the world around us. Throw me into an environment I've never been before. Take me to a country where the language is different, the cultures are different, the norms are different, and I don't recognize any of that, and I'm assuming I'm not demented. I would still have a hard time because I have no way to ground myself. Because remember, the pairing of the new information with the stored information is what gives me anchor. So when you have no familiarity to environment, then what happens is you only have preserved memories. Remember, we talked about how in advanced dementia, the only memories left are the ones up to, age 8, 9, because how many times do we know when they're talking to us about their experiences, they're really talking about the farm they grew up on, not the home they lived in before they moved into the nursing home. So really what ends up happening is when we cannot find the world around us to be able to provide us with that safe anchor, then what we do is we turn inwards. So we go back to those core memories, stored images of attachment we have when we were children. And so what happens is if we have recognition of the world around us and the pairing, and we pair that information with the stored images, and the stored images are representing secure attachments, there will be no anxious disposition. On the other hand, if those stored information is based in anxious, avoidant, or disorganized mental images, then for sure you're going to see fretful expressions. And when it gets to really advanced, then what happens? We have no recognition of the outside world. We turn inwards. And when we turn inwards, what images are we looking for where we feel we have attachments and safety with is either our parents or our siblings. And every single time you hear a resident of yours calling out for mom or dad, it is because these people have attachments which were not secure. I have a patient right now. Honestly, it's gut wrenching. She will call out repeatedly, Mommy, I'll be good. Mommy, take me with you. Mommy, it's so gut wrenching because this person is now playing out her insecure attachments into this present world in this moment because they do not have any external grounding, and the only grounding they have are memories which sadly enough are anxious attachments. So parent fixation, sibling fixation is a hallmark of a fretful expression that is based in attachment to a parent figure which represents anxious, avoidant, or disorganized. And, and so regardless of what the symptom manifestation is, guys, whether they are able to communicate or they have nonverbal communication or whatever it might be, by the end of the day, and here we talked about hoarding and collecting, somebody raised the question because it appears twice. The purpose of this expression by the end of all of this, for us to understand when we see these expressions, is that there are unmet security needs. So in essence, anything they are exhibiting, whether it is verbal or nonverbal communication, it is primarily because they have unmet security needs. And what is the meaning of this expression? The meaning of this expression, when you hear this, when you see this, is your resident is saying to you, please help me feel safe, because they're turning inwards or even outwards when they pair the new information to the old information, or when they cannot do that and only turn inwards onto their inner information. All they can reach to and all they have stored is anxious attachment images. So it becomes your responsibility in many ways. So really coming back to that earlier question, is anytime you see anxious disposition or no matter what it is, unsettled. Remember when we talked about purposeless and purposeful wandering expressions or agitation, and in the purposeless we had talked about I'm feeling afraid, or I may be worrying or thinking too much, because that is, and when they cannot tell us what they're thinking and how much they are thinking, it is really for us to then help them, or really for us to understand what they're saying to us so we can help them. So the meaning of this expression is, please help me feel safe. Now we move on to the last category, which is um, the behavioral categories, which are based in impairment of self-regulatory circuits. There are three behavioral categories here. The one behavioral category are the oppositional expressions. The second are the physically responsive expressions. And one of the things, guys, you may have noticed is the only place where I have used the word responsive is for physical expressions, because, and again, I'm not going to get into the semantics of this or the framework around this, but really that is one of those categories that could be responsive to how we deal with our residents. Everything else is an expression, not a responsive expression. And then the final one is the sexual expression. So let's talk about the oppositional expression. And here again, I'm going to take you to the world of developmental psychology, because ultimately you and I know that role reversal is a hallmark of dementia. Advanced stages of dementia, parent becomes a child, child becomes a parent, and that is what developmental psychology is all about, is the dynamic between the parent and the child. And basically, this is what it means. Developmental psychology, the expression, verbal or nonverbal expression of no, any of you who are parents and you reflect upon your child growing up, the first time they said no was the cutest thing you ever heard. And how they said no and the intensity with which they said no made your day. It didn't matter how irritating it became after the third time they would say no, but that is a precious moment. You know why? Because for that little child, when they start to say no, it is the emergence of their self identity. All of a sudden, now, a 2 year old, a 2.5 year old, or a 3 year old thinks they are a full grown, independent, self identifying human being who can self regulate. So, the word no, the expression of no, is actually a very good thing because your child is now telling you that I'm coming into my own. I'm becoming my own person, and I'm able to regulate myself. That is the essence of oppositional and of course independence. And leave me alone, I can manage everything. Mom and dad, you go away and I can be fine. So the reality is the expression of no, verbal, nonverbal, in basis of developmental psychology, which comes back one full circle at the end of advanced because there is a role reversal. So, and of course, obviously, a lot of this, and we're not going to get into this in terms of how this no, at the early stages, a child has not had developmental sophistication and is not, obviously, hopefully, thank God, developmentally delayed. But the reason why I use this over here is when it comes to advanced stages of dementia, because there is a role reversal, it is important to understand the personhood of the individual you're dealing with because it allows you to understand the developmental sophistication they may have been a part of in their life's journey. Pardon my expression, but sometimes we say, what do you expect from the wrong side of the tracks? That basically means, in other words, we're saying this patient's developmental sophistication is in the boots. And now when you have this person's developmental sophistication in the boots, and now they become advanced stages of cognitive impairment, that's a dangerous combination. And that's why it's important to understand the relationship between the two when you're trying to understand the personhood of the individual, because the information you're trying to gather is that level of sophistication they may have been a part of. And of course, the whole thing about saying no or not saying no is based in this notion of compliance versus non-compliance. When a child says no, it basically is they're saying to you, I'm not going to comply to your directions in a designated amount of time. And then obviously you have to work with them and see how this goes. So in essence, what we're really saying is the presence of oppositional expressions are the reverse role manifestation in advanced dementias of the individuals who are now in that childlike role because they are dependent, and them saying no, which is the oppositional expression, is their way of expressing to you, parent, which you are now for them, that I have an identity, I have self regulation, and I have independence. And you need to recognize that. So obviously different types of oppositional expressions, you know, um, negotiating, we see this all the time. And so negotiating is either you are not as advanced in your dementia and you have preserved social skills, or you could be advanced but have a very sophisticated developmental history So you preserve and therefore you negotiate. Then, of course, you have things like simple non-compliance. And of course, simple non-compliance is a teenager, you tell them to do something and they don't even, I mean, they hear you, but they don't do anything at all. You know, they just sort of say fine. And then, of course, you've got the passive non-compliance where you tell them to see, as you can see, she's trying to tell them, and this person is passively being aggressive about the whole thing and not listening, not wanting, you know, keep talking to me. And then, of course, you've got the direct defiance, which is basically passive non-compliance with a lot of emotion attached to it. But again, regardless of what it is, what we have to recognize is when we see emotional expressions, oppositional expressions, then those oppositional expressions, the purpose of that expression is that the person is attempting to preserve their dignity, autonomy, and self-regulation. And what is the meaning of the expression is please help me support in my independence. And you guys do this fabulously well. I mean, that's what we talked about at the very beginning. You know, a score is the least of your concerns. You guys work with your residents, you identify their strengths, and you intuitively connect with them, and you make them engage with you, because that is the reason why, you know, some people, some PSWs have that, or, you know, frontline staff have more of an intuitive thing. And I can tell you, and this is, I'm going to tell you as a doctor who gets consulted, is I've never taken more offense to anything than my colleagues coming into a nursing home high and mighty and saying it's the approach. Well, listen, we all have good people and bad people in profession, but nobody knows better than you guys what approach is. And you are intuitively connected to your residents way more than any of people in my category are, because we just show up to look pretty if we can, and that doesn't work most times. So the reality is, it is that understanding, and that's why I cringe when I hear in a consult, well, it was based in approach. Well, you know what? Easier said than done. Let's put you in there and let's see you do it and see how far you go and how many black and blue eyes you come out with. Then we'll talk about approach. So the reality is that this is that dynamic. And in many ways, in some ways, you guys become the parent and that becomes a child. And you have to be mindful of that, because now it is them saying no to you, them being oppositional to you, is them expressing their independence and autonomy, and you being able to support it, which you do very well. So, you know, obviously when it becomes impossible, then there's more to it than meets the eye and I get called in. But this is something you guys do every day. And if there was a problem with the approach, I would get 100 out of 100 referrals in every nursing home we have patients, and that is not the case. Okay, now we talk about physical expressions, and here's what I need for you to understand. For some strange reason, both of them are not. So there are two kinds of physical expressions, and this is again from social psychology, and I want to take you to those basics of definitions and then go from there. One of them is instrumental aggression, and the other is hostile aggression. These are very specific constructs in psychology literature, and it's important for us to know what we're dealing with in our world. So instrumental aggression is based in a reward consequence paradigm. So the individuals understand and appreciate the difference between right and wrong, and there is obviously assuming preserved self-regulatory circuits, But as soon as there is a reward and consequence paradigm with the ability to know the difference between the right and wrong, then what you are talking about is a criminal behavior. And I know there is a trend, and I dislike it to no end, where I'm seeing more and more of our residents being subjected to exposure to police after incidents. And of course, it's devastating for the families. Some tell me it's a ministry driven guideline. Well, I certainly hope someone can consult the ministry, brilliant people, to say if advanced people with advanced dementias had the ability to understand the reward consequence paradigm and the ability to understand and appreciate the difference between right and wrong, then they would either not be in a nursing home, nor would they be diagnosed as advanced dementias. And why are we criminalizing their behavior? And unfortunately, this has become a new norm. And the number of times I have to write to the Crown to get this BS sorted out is not even funny anymore. What we deal with is hostile aggression. And again, I don't like the term hostile, but that's a psychology term. I didn't make it. I simply picked it up from the literature. And this is what it is. It is a dynamic, what we call as a frustration aggression paradigm. And mind you, a lot of these terms are terms from the 60s and the 70s and the 80s. And in today's dates, they may not be the most politically corrected, acceptable terms for us. Um, but regardless, that is the terminology and the relationship between the frustration and the aggression. But really, this is what is at play here. The third bullet, that there is a perceived impediment of goal attainment. So the frustration or the negative emotions that come, they come when the individual is perceiving an impediment in their goal attainment. And that combined with impaired self-regulatory circuits leads to the emergence of, and I'm just going to bypass some of this, it's all there. But the key here to remember when it comes to physical expressions, guys, so I'm basically now saying not all physical expressions are the same. There are 6 or 7 subtypes or 7 reasons for physical expressions. And the understanding here is from the individual's perspective, they perceive right, wrong, whatever it is them. And they say customer is never wrong. They are never wrong. If they are feeling that there is an impediment in their goal attainment, then obviously it means it leads to generation of negative emotions and its manifestation as physical expression. So the purpose of this, anytime, and the other part in this, I must say, and I want to say this very delicately and carefully, is our ability to recognize if we are in any way playing a role in that goal attainment, if we are the impediments. And that's critical. And that's a part of what we do in mental health. We always are asked to reflect upon our own conduct and our own behaviors and how it engages with the person we are managing. No different here is we are human beings and we carry emotions, and that is why what has never changed and failed or will ever change is what Freud said, transference and countertransference. These individuals, they may have advanced dementias, but they can feel the pulse. They can catch it. If they feel there are negative vibes coming, they will pick up on it. And no matter what we try to do, we are humans, and I understand that. But here it is important. Not only are we trying to understand the impediments to goal attainment, but also if we are playing a role as being one of the impeders in goal attainment. And that is the key. And so, what is the meaning of the expression? The meaning of the expression is please help me identify that specific need being impeded. Because the only way to get past the physical expression in that context is the person is saying, work with me, help me understand the which need is being impeded and by whom and by what and by when. And so that is important. So let's then go to the meaning of expressions. Which need is being impeded? Is it the innate physiological need? Is it the security need? Is it the belongingness need? Is it the need to avoid pain? Or is it the need to cope with pain? Because all of these are going to be responsible for the manifestation. So there could be 5 reasons, and any one of those reasons could interface, change at any given point in time when it comes to the manifestation of physical expressions, because the key here is to recognize that it's a relationship between the goal attainment and impediment of that and negative emotions, which leads to high frustration and expresses itself as physical aggression. And what we have to do is find out which of the needs in any given situation was being impeded from being satiated that led to that physical expression. And it could be 5 different times they hit out, could represent 5 different needs at different times. But the idea is to understand that not every time they hit you, it means the same, it means a lot different. Now, moving on to the last category, which is the sexual expressions. Here again, I think what's important for people to understand, so in my classification of behaviors, I have 6 or 7 subtypes of sexual expressions. So, and again, I'm a very firm believer. We call it sexual expressions. It's obviously, as you know, as soon as you label those, it has a meaning of its own, it has a journey of its own, and there is nothing more divisive on the team than having to manage someone who is quote unquote exhibiting sexual expressions. But again, it's manifestation. So I'm just gonna, So basically, the So one of the manifestations of the sexual expressions, one of the underlying reasons for sexual expressions that we need to be searching for is based in misidentification phenomena. Remember, we talked about misidentification and how the stimulus from today gets paired with stored images, and only those images which are a very high emotional significance to us, thereby leading to an altered sense of relatedness to the outside world. So anytime when you are called in to assess sexual expressions, try to ascertain if this individual is misidentifying or over-identifying the person they are trying to be intimate with as their girlfriend, their wife, or someone familiar to them in their life's journey. Because if that is what is happening, then they are basically showing, expressing intimacy in context of a defined relationship in their mind that is consensual. So it's important. And I'm also a very firm believer, with the exception of one type of sexual expression, everything else is expressions of intimacy. It is not sexual. I wish we would just get away from this term and just use intimacy expressions. Maybe that's what I'll do. I'll change it to intimacy expressions and work. But the one subtype is this. The second subtype of a sexual expression, which is rare, and I can tell you because, and the reason I say it's rare is, how many times have you guys seen in men particularly, and also I think a lot of us recognize a lot of these sexual expressions, rarely are women ever exhibiting them. I can't remember the last time I was ever asked to go see a woman, a female resident with sexual expression. It's always men, and one of the reasons, and one of the things that always gets done, well, let's get their testosterone level because we're going to throw them on cyproterone acetate or medroxyprogesterone acetate, and when the levels come back, their testosterone levels are undetectable, and yet they are quote unquote hypersexual, thereby going to tell you that sexuality has absolutely nothing to do with testosterone levels alone. That's a very pejorative interpretation of a part of our history that was always affiliating big bad men with sexual transgressions, and they were all beasts because they had horrible high levels of testosterone, but that is not the case. And none of these patients I have ever seen them to have high testosterone levels. And so obviously, but what we do know is that if their motivational circuits are impaired, and if their motivational circuits are impaired to result in high levels of motivational drives, then we know under importuning expressions, which are either based in normal or heightened, you can have heightened, and that is the increased drive to satiate innate physiological need of not even sexuality, sorry, it's an old slide, of pleasure. And that could be one manifestation or one reason for manifestation of a sexual expression. Now, this is the other manifestation, is that it has got nothing to do with the heightened motivational drives. It has everything to do with normal preserved motivational circuits, but yet it is to have the satiation of the innate need for intimacy, which can fall under importuning expressions. So as you can see, sexual expressions can fall under misidentification, they can fall under goal-directed, they can fall under importuning, and then they can also be based in emotions and cognitions of discontentment, the misogynistic tendency. I have been called so many times where you've got these, again, men, and they're saying all kinds of graphic, nasty things to PSWs or nurses. It's because they are miserably discontented and they are misogynistic in their disposition. And basically, it is again one of those things is you create barriers to avoid pain, and you say mean and nasty things, but obviously what's happening, because now they are cognitively impaired, it's having just the opposite effect on the team dynamic or your relationship with the people, and it just worsens the situation. And of course, people who are subjected to this can only take so much for so long. I have seen such seasoned people break down because there's only so much you can take. And but the key here is to understand that one of the reasons for manifestation of sexual expressions, which are manifested through such graphic language, horrible put down language, really is based in emotions of discontentment to create barriers for the relationship so as to prevent avoidance of pain. And then, of course, the last manifestation of there's one more after this, one is that of feeling safe, because it's all about intimacy and feeling going and sitting with someone and feeling safe is only normal. And so many times I get called in, it's a sexual expression, but the more you realize, the more you understand, you recognize that whatever attachment they are exhibiting with this person is based in anxious, avoidant, or disorganized mental images of attachment, and therefore they are stuck to their hip. Wherever this person goes, whether it's a male or a female, they follow. Now you try to separate them, and if it's a guy, you're gonna get clobbered. And why you get clobbered? Because that physical expression is based in the impediment of satiation of security needs, and you happen to be the person impeding that satiation. So it all comes together if you understand this paradigm in the sense of how to approach people, how to understand the meaning of these expressions. And of course, the final is the staff perception. I have to tell you the number of times I get called in and the recall at the moment when some incident occurred, and then the recall 6 days later, and the in-between stories are just wonderful. So one of the reasons, and I firmly believe, is misinterpretation of these expressions by staff. And they don't mean to do it. We are human beings. And I mean, so many times, I mean, I remember this case so succinctly. I had this, a charge nurse who was very, very strongly Catholic religious. And one of the patients was also of the same genre, and her husband would come, and somehow this male started to follow this person. And truly, this charge nurse lost perspective, and anything that happened between the two of them started to be getting labeled as sexual in nature. And of course, imagine passing this on to the husband of the person who is strongly religious, and it was a nightmare. And ultimately, we always say sexual expressions many times are problems of the staff more than they are problems of the residents. And one has to be very careful. So what does this mean? I'm just gonna, sorry. So the purpose of this expression, when you see sexual expressions, guys, is really take a step back, take a deep breath, and don't judge, don't label, because that is when a lot can and does go wrong. And the meaning is, this person is simply saying to you, before you label me, make an effort to understand my reasons. Are my reasons based in misidentification? Are my reasons based in satiation of innate physiological needs? Are my reasons based in preserved intimacy needs? Are my reasons based in avoidance of pain? Are my reasons based in finding a safe place, or am I being mislabeled? So again, 6 subtypes of sexual expressions. That is indeed the last slide, guys. Thank you. I didn't think I was going to get through this, but I have. And I know there's a lot of stuff that may be new. Perhaps many of you know some of it, some of you may know all of it. I don't know. But all I am offering you, again, I keep saying, if what's working for you is working for you, please stay with it. But if you have any doubts, if you have any questions, if you have any struggles, I have an alternative. I've been using it for about 4 or 5 years. I am now starting to put out outcome evaluation results. And I have to tell you, it works. It really works. Not because I'm saying so, because I made it up. It's because now the evidence is, and again, it's a lifetime project. I'm not going to have all the evidence and outcome tomorrow. You know, it's slow as molasses journey. But again, thank you, Stacy, Inat, and Selma for allowing this opportunity. I'm honored, I'm humbled.